joined by a very specialist uh, doctor who is diabetologist and who takes care of all the hormonal concerns. His name is Dr. Ebenezer Rajadurai, and he is a medical director at prestigious Devadas Hospital. Dr. Ebenezer has been taking care of thousands of patients over the course of last many years, and he has been reckoned as one of the specialists in his domains. Today, the topic that we are going to discuss is thyroid troubles. A lot of people suffer from thyroid, right? So they have to navigate hypothyroidism and hyperthyroidism. So if you or anyone, any of your family members or friends are facing this challenge, this is for them. And you can share this live session with them. And also we'll be recording this session and sharing across all social media platforms in which Cureka is having a channel. So let me not take much of the time and introduce you to Dr. Ebenezer. So, good morning, Dr. Ebenezer. How are you?
Good morning. I'm fine. Thank you.
Yeah, thank you so much for joining us today. And it's a pleasure to have you with us, Doctor. So, Doctor, today we are going to cover a very important topic of thyroid troubles. A lot of people suffer from thyroid issues, whether that is hypothyroidism or hyperthyroidism. So, let's try to navigate through what are the different challenges that people take. So, the first question that the listeners want to know is what signs may indicate the early onset of thyroid issues?
Yeah, so thyroid is a very important problem, and occasionally it doesn't come with sinister signs. It comes very slowly. So important things to note is with regards to thyroid is in hypothyroidism. That is where the thyroid functions less than what it has to. The usual symptom is patients will be feeling intense cold. Everybody else will be feeling normal, whereas they'll be feeling sense of cold. They'll be feeling chillness. They will have a weight gain. So they might be eating less, but then they might be gaining more weight than what they have to. And there'll be a lot of skin dryness that can happen. Along with that, usual common thing is there can be hair loss. There can be menstrual irregularities in women. So they can have increased menstrual flow, which is common. And also the most common presentation in a younger age group is infertility. They'll get married, but they'll have infertility, and that during evaluation is when they are found to be hypothyroid. Whereas hyperthyroid is exactly opposite of this spectrum. So a hyperthyroid patient, they'll have increased sweating, they'll have palpitation, they'll feel that their heart is beating fast. They'll have weight loss. They might be eating more, but they'll be losing a lot of weight along the way, and they'll have diarrhea. So they'll have stomach problems along with that. And these are the main things, early symptoms, as you were asking, of both hypothyroidism, that is where the thyroid functions less, and hyperthyroidism, where the thyroid functions more than what it has to function.
Right, right. Thank you so much for sharing that, doctor. So, guys, if you have any questions around thyroid issues, please do let us know in the comment section below, and we will try to take them up during this live session. So, doctor, how does an individual experience symptoms when dealing with thyroid problems?
Yeah, so how do we handle the symptoms you're asking? Yeah,
Yes. So, how does an individual experience symptoms?
yeah. So, as I had previously mentioned, these are the symptoms that the individuals will usually have. That is feeling of increased coldness. They'll have weight gain, constipation. They'll also have associated symptoms of lethargy. Occasionally, can manifest as mood symptoms. They can have depressive symptoms. So, this is for hypothyroidism. Ideally, if you have any of these symptoms, and you are not a previously known person with any other medical problem, say for example you don't have diabetes or hypertension, it's best to immediately get yourself evaluated, because usually the common health checkups might not have thyroid along with that. So unless you have a strong suspicion, you might not get yourself checked properly. So with regards to hyperthyroidism, as I said, the spectrum is exactly opposite. So You are eating normally, but you're losing a lot of weight. You're sweating a lot. There's a lot of palpitation. You're feeling your heartbeat is fast. You have some continuous stomach problems, and you go to a local doctor. They say your tummy is okay. I mean, there's no ulcer symptoms or anything else, but why you're having loose stools? So in that case, you start suspecting that probably I have some thyroid issue, and that is when you have to go and meet the local doctor.
So, doctor, a lot of people, when they start experiencing the issues, first, I believe they are worried about which doctor to consult, because sometimes it comes across as a gastrointestinal issue, right? So, at what stage people should start contacting, a thyroid specialist doctor?
Yeah. So as such, I would say the best way to go ahead is, if you have any of these symptoms, to consult. The first step I would suggest is to consult your family doctor. So that's the first step. So because they'll have a better overview, because this involves multiple systems. Thyroid is hormone that actually involves multiple systems, right from your brain, along with the GI symptoms, your skin, your heart. So you have to fit in all together, and the best judge of that would be a physician or your family physician. So because it's a spectrum of disorder. So then the next important step is, a lot of people are very hesitant to do a health checkup. A lot of people are hesitant to get a complete health checkup. So anybody who is into their adulthood, it's best to have a checkup done. And a lot of times, especially in the married couples, young married couples with infertility, or young women, not even married, young women of the reproductive age group with menstrual disorders, they might be evaluating with ultrasound and other things, but then you do a thyroid, the thyroid is abnormal, you treat it, the patient gets better. So it's more of a suspicion, and I think the best person to have that that perspective would be a physician, along with the symptomatic. For example, menstrual disorders, you will be going to a gynecologist. So again, they'll be suspecting whether there's thyroid and evaluating. I think the first step is to go ahead and consult, not thinking what it is, and because sometimes very difficult to patch all these symptoms together.
True, doctor. Right, rightly said. So, doctor, what distinguishes the hyperthyroidism from hypothyroidism in terms of symptoms and effects on the body?
Yeah, so the thing is, as I had previously mentioned, both hypo and hyper, that is thyroid as such, the function of thyroid is what it regulates multiple systems in the body. That is, it regulates the brain, regulates the heart, regulates the reproductive systems. So what differentiates is, it affects the same organs. Both diseases, either hypo or hyperthyroidism, affects the same organs in an opposite way. So a hypothyroid person might feel very lethargic, might have depression. So depression is a very common presentation of hypothyroidism. We might be wondering, why am I depressed? Or others might be wondering, why is this person depressed? Everything in his life or her life is normal. So it might just be hypothyroidism. So whereas hyperthyroidism will have the exact opposite effect. They'll be anxious for trivial things. They'll have increased sweating, they'll have palpitation, and for small things they might be more anxious. That's a symptom of hyperthyroidism. With coming back to the reproductive system, in women especially, so thyroid disorders are very common in women mostly. So in women especially, hypothyroidism will have increased menstrual bleed, whereas hyperthyroidism will have a decreased menstrual bleed, and both of them can cause infertility. So a lot of times young couples, when they don't have a baby and they were getting evaluated, a lot of times it's just thyroid disorders, and they get corrected and they do very well. So it's the same organs, but a opposite spectrum that they usually present with for thyroid disease.
Right, doctor. Right. So, doctor, what factors contribute to the development of thyroid problems?
Yeah. So thyroid disorders, so is most common cause of thyroid disorder something known as autoimmune. So autoimmune is when your body starts acting against its own. So that can happen because of genetic reasons, because of our environmental exposure, because of a lot of processed food intake and other things. Science is still to exactly pinpoint the trigger, but these are autoimmune disorders. So both hypo and hyperthyroidism is contributed by autoimmune disorder, where our own body's police cells go and destroy the thyroid, and so its function either goes less. Initially it might be more, and then subsequently it might be less. The next most common cause, which is actually sort of come down quite a lot, is iodine deficiency with regards to hypothyroidism, because of mandatory laws which says all salts that are produced in our country, iodine has to be added. These are the second most important cause. Third causes of hypothyroidism and hyperthyroidism is drugs. Occasionally drugs like amiodarone, and those are drugs that might be regularly taken by the patient, which can actually go and deposit in the thyroid and make the thyroid function less. But usually doctors who prescribe these are drugs that are given for the heart, so will usually advise the patient to check their thyroid at regular intervals, and if there is a change, they will usually end up changing the drug to another drug.
Right, doctor. Right. Thank you so much for sharing that. Doctor, between hyperthyroidism and hypothyroidism, which condition is considered more severe?
So both are actually can turn up to be severe. So only thing is, thyroid disorders usually evolve very slowly. So it might not have an effect on you suddenly on a day. But there is something known as thyroid storm that can happen in hyperthyroidism, where suddenly the patient develops excessive palpitation because the heart is working more. Suddenly, they can develop a cardiac problem, as a major cardiac problem as such. Same with hypothyroidism. If the thyroid keeps on functioning less and less and less, what will happen is there's something known as myxedema coma. Your brain becomes more and more lethargic, where patients occasionally they slip into coma. They actually end up in coma. So that can happen. But then there are early signs, as you had previously asked in the previous question. It's always good to pick the early signs and not wait till these symptoms develop in a much later date. But yes, thyroid, although it looks very benign, can have medical emergencies like myxedema coma and a thyroid storm, affecting our central nervous system and our heart.
Right. So, doctor, whenever we talk about thyroid or anybody talks about thyroid, a term is used very common, that is TSH. I believe that is thyroid stimulating hormone, right? So, what is the normal range of TSH levels in the body, doctor?
Yeah, so the normal level of TSH is 0.3 to 4.5, and then if the TSH is more than 4.5, that is, the thyroid stimulating hormone is in an excessive level. So when does it go in excess? When the thyroid is not functioning well, it wants to stimulate it more and more. So if it's more than 4.5, that means thyroid is functioning less. That means that the patient has hypothyroidism. When the TSH is less than 0.3, that means that the TSH doesn't want to go and stimulate the thyroid at all, because the thyroid is already functioning more than what it has to. So that condition is known as hyperthyroidism. So although the values are inverse, the function of
Correct.
TSH is to
Correct.
stimulate. So this is the
Right.
normal range of TSH.
Right. Understood, sir. Thank you so much. So, doctor, is thyroid dysfunction generally regarded as a serious health problem?
As I had previously mentioned, it is a serious health issue. If you leave it unattended, slowly your heart, the brain, and the other reproductive organs, and including all the organs. Actually, thyroid is a particular hormone which is actually required across the spectrum to function for all the cells in our body. It's not just for a particular system. So everything will start to functioning less in case of hypothyroidism. So the best way to avoid that is to identify the symptom and pick it early. So yes, there are medical emergencies with thyroid disorders which can actually lead to serious health problems. So I have seen quite a lot of patients who come with breathing difficulty, cardiac
Oh,
issue, and then you
oh
evaluate the
my God.
patient. These are young patients, I would say 30 to 40. So you evaluate the patient and you look at the spectrum. They actually don't have any blood vessel blockage. It's not a heart attack. So evaluate the thyroid is extremely high, and because of that, the heart is not functioning well. There is fluid around the heart, and because the heart is not functioning well, there's fluid stored all over the body. The patient will have something known as anasarca, and then you treat the thyroid, they improve dramatically. So thyroid is an important thing which needs to be identified and treated.
Right. Thank you for sharing that, doctor. Doctor, what are the initial indicators of thyroid dysfunction?
Yeah, so the initial indicator might be just something that might look benign, like in women, especially, as I had previously mentioned, thyroid disorders are very common in women when compared to men. Will be a mild menstrual irregularity, will be just a hair loss which is not really explained by any other cause. It can just be you feeling increased cold when you have to wear a sweater, when everybody is actually saying, why are you wearing a sweater? I mean, it's not that cold. Or you'll feel that your skin is dry. You're not old, you're not aging, but your skin is very dry when compared to the rest of the counterparts. Or you're doing the same work, say a software engineer is doing the regular programming, or but then suddenly they realize they're feeling more lethargic, they're feeling tired, they're not able to concentrate in the work. So these might be subtle signs which might indicate that they're developing hypothyroidism. And the opposite for hyperthyroidism, they're feeling more anxious to do the regular work that they're doing, and they're feeling palpitations just by walking one flight of stairs. Again, they will feel increased sweating. They never sweat a lot, but suddenly they're sweating a lot, and they're losing a lot of weight. So these things are indicative of hypothyroidism. Very subtle signs which we should pick up.
Right. So, doctor, now let's talk about food habits, because food has a lot of impact on how these thyroid levels they behave. So, what food should be avoided for individuals dealing with hyperthyroidism and hypothyroidism?
So in hypothyroidism, we want to avoid foods that actually makes the thyroid function less. So known as goitrogens. So the food that we usually avoid in hypothyroidism are cruciferous vegetables. They're known as, because they have this crunchy texture in them. So the common food is cauliflower, broccoli, cabbage. These are known as cruciferous vegetables which we avoid in hypothyroidism. In case of hyperthyroidism, as such, there is no specific food, but we would like to avoid iodine rich food or excess intake of iodine rich food, because you don't want to feed the monster. You don't want to stimulate the thyroid more. So in that case, you would like to keep your salt, iodized salt intake and your seafood intake to as less as possible. So this is foods to avoid. So if you're coming to the question of foods to take, it's exactly the opposite. So for hypothyroidism, we want iodine rich food. So you want iodized salt, seafood, which is actually rich in iodine, and non-vegetarian food, which also has iodine. So these are food that are rich in iodine. Mainly it's iodized salt. In case of hyperthyroidism, you would want, what happens is hyperthyroidism actually goes and destroys the bone. Thyroid is actually important for the bone too. So it will go and sort of erode the bone. So the way we have to give constituents to the bone to improve itself. So we would require a lot of vitamin D and calcium, either a supplementation with tablets or food rich in vitamin D and calcium. That will be milk and other things which we need to increase in hyperthyroidism.
Right, right. Thank you for sharing that, doctor. Now, doctor, a lot of listeners are asking us a question: at what age does thyroid dysfunction starts to emerge?
So there is again, it's not a particular age, but a few instances or in the spectrum of ladies' life, because thyroid is very common in women. First is usually it's around the time of teenage, where they'll start to develop hypothyroidism because of autoimmune causes. And usually there's a main symptom will be lethargy or menstrual irregularities. The next important time where thyroid disorders happen is pregnancy, because pregnancy itself can cause thyroiditis and thyroid dysfunction. So it's very important, and it's become a protocol now to check thyroid levels during the time of pregnancy. So that's the next important time. Third important time is perimenopausal, where Again, around 40s, usually the symptom starts, and the last is in a senior citizen group, that is the elderly group, more 60 and above. So these are the four times when thyroid disorders usually commonly manifest. It doesn't mean it doesn't manifest at other times, but these are the times when it commonly manifests.
Right, doctor. So, doctor, now can thyroid disorders, whether that is hyperthyroidism or hypothyroidism, they can be effectively cured completely?
Yeah, so if it is a mild thyroid disorder, so the TSH is mildly elevated and hypothyroidism is there, there are, as I had mentioned, there are some more contributors to thyroid disease, which can be, one is a lifestyle issue itself, so which causes a mild thyroid dysfunction. So in case of mild thyroid dysfunction, changing lifestyle with good amount of exercise, weight loss, a natural healthy diet with a lot of fruits, vegetables, which are antioxidant rich. So these sort of diet and supplementation, if needed, will really help in case of a mild thyroid dysfunction, mild hypothyroidism. But other than that, hypo and hyperthyroidism require medical assistance and medications for good control. So it's reversibility, unlike diabetes, which is actually more reversible than hypothyroidism, is not the thing. It's more of drugs control, and then you lead a normal life.
Right, right. Okay. So, doctor, is it as advisable to consume milk for individuals with hyperthyroidism?
Yeah, so as I had mentioned, actually milk is a good source of calcium, and hyperthyroidism, because it will actually go and cause bone destruction. So we require calcium to again rebuild the bone. So milk is actually advisable to take. It's not something that we should avoid in case of hyperthyroidism.
Right, doctor. Thank you for sharing that. Now, doctor, are there specific foods known to contribute to the thyroid issue?
I'm sorry, pardon.
Are there specific food that are, known to contribute to the thyroid issue that increase the thyroid if somebody is having thyroid?
Yeah. So I would maybe in the present trend, as I had mentioned, previously, iodine deficiency was one of the most common causes of hypothyroidism. It contributed to quite a lot of problem where children's development was affected. A lot of them growth was stunted, mental retardation was there. It's sort of overcome now because we use iodized salt, but there is a trend where we are more starting to use less of iodized salt also,
Hmm.
procuring salt without iodine. So you need to be little careful. You need to take a balanced approach there, because if your iodine intake goes down, there is a chance that hypothyroidism might set in, especially in children where they are in the growing age group. You need to be careful. So that is one particular food. And as I had said, in patients who already have hypothyroid, you would need to avoid cruciferous vegetables. So because they are goitrogens, they can go affect the thyroid and make the thyroid produce less thyroid hormone. So with regards to food, it's mainly these two one needs to be careful about. Other than that, it's, as I had said, the common cause of thyroid disease is autoimmune. So it's the body against acting against itself. So yeah.
Right, understood, doctor. So, doctor, a very interesting question is coming from listener. They say, can high level of stress contribute to the development of thyroid problems?
Yes, so stress can contribute not just to thyroid but to multitude of problems, because what stress does is, how does body respond to stress? So body is a set of biochemical reaction, correct? So we are all chemistry and physics together. So how does body react to stress? It produces something known as stress hormone. So adrenaline, cortisol, glucagon. So what does these three do? They make the body work much harder than it can, produce a lot of sugar, so that you have this evolutionary flight response. So either you fight or you run. So that response. So what it does is it produces a lot of oxidants in the body. So a lot of chemicals which are highly reactive, and they will go and affect each and every part of the body if it continues. So this fight or flight is supposed to be for a few minutes. But if stress is, you are stressed throughout the day, 365 days a year and 24/7 a day, then what happens? A lot of antioxidants, it goes and affects especially the heart. Yes, it can affect the thyroid and other organs, can cause diabetes, hypertension, multitude of problems. So yes, stress can cause hypothyroidism also.
Right, right. Thank you for sharing that, Doctor. I hope that clarifies a lot of questions from our listeners. Now, Doctor, does engaging in loud activities like shouting have an impact on the thyroid function?
Yeah, so if it causes stress, yes, it can cause hypothyroidism. But if
Right,
it's pleasurable and you're enjoying it, no. So that's how it is. That's how the relationship is.
right. Now, especially for the people in the profession of like they need to like little bit shout, like teachers or So will that be impacted with their health of thyroid?
If they are stressed, if they are shouting so that more students are able to hear what they are saying and they are enjoying what they do, no, they are shouting because students are shouting and they are stressed, yes. So that's how it is. The relationship is purely based on stress. It's not about the decibel, it's more because of the stress. And human ear has a particular decibel. You go beyond that, however you're in a music concert, you're trying to enjoy too, you will still get irritated, and that will again cause the
Understood.
stress.
Understood, doctor. Understood. Right. So, doctor, last question of the day coming from a listener. So, can thyroid problems be a potential cause for other problems like stress or headaches or any other thing?
Yeah, so thyroid problem is not just for stress and headache. Thyroid problems actually can precipitate cholesterol problems. So thyroid is important
Okay.
in the metabolism. So you might not be eating
Mhm.
very less fats, but then thyroid problem as such will precipitate to cholesterol issues, which can lead to a heart attack. So uncontrolled
Mhm.
thyroid. So thyroid is very bad in that way. And thyroid problems actually can precipitate to patients developing insulin resistance and
Right.
subsequently precipitate diabetes. So that is how bad thyroid can change into, although it's a benign disorder. So that's why it's very important to identify thyroid diseases. It is because it involves the functioning of the whole body. It can affect and cause other diseases also.
Right. So thank you so much, doctor. This was our wonderful session, and thank you for your time, sharing us your insights, valuable information, and your wisdom in helping our audience to understand what are the impacts and how they can deal with hypothyroidism and hyperthyroidism. So thank you so much. We wish you a very very happy weekend and a very happy Diwali, doctor. We
Happy
hope to
Diwali to you.
be in touch with you again.
Thank you.
Thank you, sir. Thank you so much. So, guys, that was Dr. Ebenezer Rajadurai, medical director at prestigious Devadas Hospital in Madurai, a well-known diabetologist, a well-known thyroid expert. So, guys, if you have got any questions for us, please do not hesitate to ask us. We are always ready to listen to you and to answer to your healthcare queries, whether that is respect to weight loss, whether that is respect to any of the body parts, any health problems with regards. We have covered a lot these days. You can browse through our social media channels to understand what all we have been doing, and we have been getting enormous love from you through our WhatsApp channel. Thank you so much for that. And we are glad that you are giving us a lot of opportunities to serve you through, your online purchase of health products, which are handpicked by a team of expert doctors and very affordable rates. We are able to deliver them at the fastest possible time, which is around 4 to 5 days. We are able to deliver most of the orders, and we are trying to make it faster by opening multiple hubs across India. So, guys, if you have any question or requirement of a healthcare product, do check out Cureka.com, your go-to platform for health products that is being used by multitude of people across India. A lot of people, a lot of celebrities have also endorsed us and they have endorsed our platform, the products that we are offering. Very recently, many celebrities have also endorsed Health ETC brand, which is available exclusively on Cureka.com. These are healthy healthcare gummies that you can use to lead a healthy life. Very fun product. It's not like any medicine or something like supplement. We have in multiple varieties like hair health gummy, women health gummy, immunity gummy, gummy on the go, and go to sleep gummy, which is been phenomenal results for people with anxiety, stress, and sleep disorders. With this, I am your host for today, Rahul Nanuhal, thanking you for joining us for this session, and we hope to connect with you again in the next week. Thank you so much, and have you a very, very happy Diwali and a very happy weekend. Thank you, guys.